So, as a pediatrician, what do you see the referral process for pediatricians in the rural areas? How should that look?
Yeah, yeah. So, we spend a lot of time with rural families here in Arkansas. A huge population of our state has minimal Wi-Fi access, has minimal access to pediatric subspecialists, has minimal access to pediatricians sometimes, and you have a lot of family practice docs who are doing an awesome job managing whole families and learning this huge spectrum of disease. But that does also, to your point, make it difficult sometimes to know, you're trying to juggle all these different things. You've only got a small population of subspecialists around you and want to be able to do everything you can from your office for your families when you can. And I think that's a very, very difficult thing for a lot of our rural practitioners. And so I think, and this is something that I would want to double check with you and make sure is okay. But the biggest thing I can encourage from our rural pediatricians and our rural family practitioners is if you're seeing some of these things and you're going, man, I don't want to have my family drive in 3 hours to go and see a neurologist if they don't need to. Man, I don't want to have to, be starting extra therapies and stuff if there's something that's going to get better by me just watching and waiting it. I think the biggest thing I can encourage there is pick up the phone and call somebody, right? You can get a local neurologist or one of the, especially here in Arkansas, one of our awesome neurologists. You can ask for Dr. Panda specifically every single time, and say, hey, I've got a concern for a Duchenne kid, and just want to run something by you. And you will always, from one of your local children's hospitals, from here in Arkansas, our children's hospital, get a reply and get an answer to help guide you in these things. So, I really hope that our rural practice practitioners will, just utilize those who are around them in trying to make these decisions for their families, because they're not always easy decisions.
Yeah, I agree. I think, there are a lot of primary care providers who are not connected to a hospital system. I think it's really important that connection, having that communication with the specialist, and like you said, pick up the phone and just call your friend neurologist, whoever they are, and it's easy to get these patients in, sooner to see them and then in the clinic rather than kind of going through a regular referral process. That's going to take some time. Um, I agree. Pick up your phone and
Yeah,
call me.
yeah, yeah. So I
Yeah.
think, in terms of just the process for those who aren't connected to a hospital system, I think we're probably in agreement there. That's probably the easiest way to get these kids in, right? It's just, I said, I want your blessing on that before I tell everybody to just call the neurologist. But yeah, I think that's a great way to ask questions and to get these kids seen fairly early.